Hi everyone, my name is Dr. Tony Setiobudi. I'm an orthopedic and a spine surgeon at Mount Elizabeth Hospital, Singapore. Today I want to share about osteoporosis, brittle bone disease. But if you are new here, please don't forget to subscribe and activate the notification button. I will share more medical info that is accurate, up-to-date, and trustworthy. What is osteoporosis? Osteoporosis is a brittle bone disease. The bone mass is reduced. It can happen with age and after menopause. It can occur as a result of hormonal problems or long-term steroid use. About 25% or more of people aged 70 to 79 years suffer from osteoporosis. It is more common in women than in men. What are the signs and symptoms of osteoporosis? Osteoporosis is a silent disease. The most common early sign of osteoporosis is a fracture. Many people may not know that they have osteoporosis until they have a fracture. Hence, the most important treatment is prevention. Osteoporotic fractures typically affect three parts of the body: the spine, the wrist, and the hip. But it can happen elsewhere. People who sustain spinal osteoporotic fracture experience severe back pain and a worsening stoop posture. Nerve injury can occur as a result of the spine fracture. If the back pain is severe and prolonged, a procedure to inject cement to the fracture is recommended to give immediate stability to the bone. The pain can reduce significantly right after the procedure. It is a minimally invasive procedure that is suitable for the elderly. Wrist fractures typically present when the patient falls on an outstretched hand. The wrist may be deformed. Sometimes it needs surgery. Sometimes it can be treated conservatively without surgery. Hip fractures is probably the worst type of osteoporotic fracture. It is estimated that 800 to 900 hip fractures occur in Singapore every year due to osteoporosis. About 1 in 5 patients pass on within a year of sustaining an osteoporotic hip fracture. What are the causes of osteoporosis? Bones are constantly breaking down and renewing. In young people, new bone is produced faster than it breaks down. This increases your bone mass, which peaks at around 30 years of age. After this, the process of renewal slows down, with bone breaking down faster than it can renew. This results in loss of bone mass. Then osteoporosis can happen. Calcium is an essential mineral in bones. Approximately 99% of calcium is found in our bones and teeth. The strength of our bones depends on how much calcium is present in them. We can imagine the process is like saving money in a bank. Calcium is the currency and our bone is the bank. The retirement age is 30 years. After that, we can only withdraw calcium and cannot save it. If we have enough calcium saving, we are not prone to developing osteoporosis. However, if we don't have enough calcium reserve, if we don't drink enough milk, we don't eat enough vegetables, green vegetables, or we don't do enough exercise, we can suffer from osteoporosis easily. Therefore, all of us, starting from when we are young, must have adequate calcium intake. What are the risk factors of osteoporosis? Osteoporosis may affect anyone, but the following groups are more at risk. Number 1, women. Women are more at risk than men. They have smaller bones and lose bone mass more rapidly than men due to menopause. And number 2, elderly. The older you are, the higher your risk of osteoporosis. This is because our bone mass starts to decline after it reaches its peak in young adulthood. Number 3, lighter skin color. Caucasians and Asians with light skin color are at higher risk than darker skin races. And number 4, family history. Individuals with family history of osteoporosis are more prone to developing osteoporosis. How to prevent osteoporosis? Osteoporosis is preventable to a certain extent based on our lifestyle choices. Some measures include doing weight-bearing exercises, consuming a diet adequate in calcium and vitamin D, being out in the sun regularly, and avoiding smoking and excessive alcohol intake. Weight-bearing exercises are beneficial to maintain the bone density. It prompts the body to produce more bone. This can include everyday activities such as walking, stairs climbing, cycling, and so on. Calcium. The recommended calcium intake for healthy people without osteoporosis is 1000 mg per day. This recommendation is increased to 1200 mg per day for elderly and people with osteoporosis. Good sources of calcium are green vegetables and dairy products such as milk, yogurt, and cheese. In addition to balanced diet, calcium supplements are also helpful only if you are unable to consume enough from regular food. Vitamin D. Vitamin D helps your body to absorb calcium from the gut. You can discuss with your doctor your vitamin D requirement. Different people have different vitamin D requirement. Regular exposure to sunlight can prompt your skin to produce its own vitamin D. Good food sources of vitamin D include fatty fish such as mackerel, salmon, and tuna, and other foods such as dairy products are also fortified with vitamin D. How is osteoporosis treated? Osteoporosis is highly treatable. There are many different types of osteoporosis treatment. Each treatment has its risks and benefits. Therefore, it is essential to discuss with your doctor which osteoporosis treatment is suitable for you. And final advice, osteoporosis is a silent disease that can go undiagnosed until it is too late or till you have a fracture. Prevention is the best treatment. You can reduce the potentially serious complications of osteoporosis by paying attention to your lifestyle. I hope this information is useful to all of you. Don't forget to subscribe, like, and share this video. And I hope to see you again in my next video. Bye-bye.